to the U.S. Healthcare Insurance, an overview of government-funded programs and key terminology, with our presenter, Gissel Nevarez-Grubbs, who is a medical interpreter working at Chalk Children's Hospital for inpatient and outpatient services. Gissel has a bachelor's degree in interpretation and translation, and she's a candidate for a master's in Spanish literature from Cal State University of Long Beach. She is a certified interpreter through CCHI and has worked in healthcare for over 15 years. She's completed the LA Healthcare 40-hour interpreting training, Children's Hospital of Phoenix medical interpreter training, and the CHIA standards training. She is a volunteer with the Flying Samaritans and as a medical interpreter and with the Voice of Love project. And I've had the lovely opportunity to work with Gissel a few years back when we were both on the conference committee, the organizing committee for CHIA, when Gissel was one of our board members. And she's presented a number of times at CHIA, so you are in for a treat. And this is a topic that I think is obviously very timely and can get quite complicated. So with that, Gissel, I'm going to go ahead and pass the controls over to you. Thank you for joining us today.
Great. So I will just, I think Michelle has a very old bio of mine, so I do apologize. I haven't worked at Chalk for quite some time. In my most recent role, I was working for Molina Healthcare as a Director of Translation and Interpreting Services there. So I do have over 20 years of experience in healthcare, and it's a topic very dear to me because I've been in it for so long, and I've been in language services for over 10 years at this point, in different roles from interpreter to translator to leadership roles in project management specific to translation. So I hope everyone finds this very interesting and useful. So let's get started. Oops. So the objectives of today's webinar is to help you learn by the end of this webinar what government-funded medical insurance is in the United States. So we're going to keep it specific to the United States. I hope that you will gain knowledge on the topics that are often discussed with members in the healthcare insurance market. You're going to learn where to find information, how to create glossaries, to help you prepare for the various topics that will happen when you're discussing medical insurance or healthcare. And I will switch between medical insurance and healthcare insurance. It's the same thing. They're synonyms of each other, but depending on who you're working with, they'll use the different terms. I do want to specify that the purpose of this presentation is not to help you or anyone else make decisions about their healthcare coverage. I am not a broker. I am not here to promote any specific healthcare company. I am here to just inform you and educate you about all the different things going on in healthcare insurance and different types of coverage. So as interpreters, you feel a lot more prepared and knowledgeable to handle those types of interpreting sessions. I want to challenge you to be an active listener. I will be using lots of different terms that are very specific to healthcare. These terms, as you're listening or seeing them on the slides, think about them and quickly do an interpretation in your head or determine if you even know how to interpret that term. I know in sometimes even for primary English speakers, the healthcare topic and issues can be confusing in English, let alone in another language, especially for language or LEPs, limited English proficient members and population who are not used to the US healthcare system. Think about what topics might come up when you're interpreting for a healthcare company or a case manager or someone that works in that healthcare field. Do you know how to interpret those topics? And do you feel prepared? So let's talk about why we should even care about this topic. Nearly 20 million people have gained health insurance since 2010. That's an astounding number. We have a ways to go, but that is an astounding number. The rates of uninsured are declining, meaning that those people who do not have insurance are declining. So more and more people are getting some type of healthcare coverage. And health plans are required by law, especially if they participate in any government-funded programs. They are required to provide language services. This is good news for the members, and this is good news for interpreters, because that means job security for you. For members, it's great news because that means they have the right to request interpreting services or translated documents for that matter, especially under a new law that came into effect, referred often as the Section 1557, the Affordable Care Act. And that discrimination clause or non-discrimination clause has given insurers additional requirements on what kind of language services and access they provide to their members. In this graph, I want to just show a little bit further the number of people that are insured, whether it's private or government-funded insurance, and those that are uninsured. You will see that the lowest line here on this graph are uninsured. So that's good news. That means people are getting some kind of healthcare coverage. There's some debate as to how great that healthcare coverage might be, but either way, it's some kind of coverage. This also shows you, especially the graph on the right, which the percentages of people who are native born, foreign born, naturalized citizens, or not a citizen at all. For interpreters, it's important to be aware of this population because these are the people that are most likely to need interpreting services when dealing with healthcare insurers, clinics, hospitals, doctors, you name it. Additionally, along with this Section 1557 that we mentioned, this law, healthcare insurers are required to know the top 15 languages that are often spoken and used by the population in that state. These top 15 languages might change county to county. So insurers or companies that provide insurance have to be aware of what those languages are in the counties they serve. In California, we have a very robust population when it comes to different ethnicities and languages that they speak. This is an example of the kind of information that has been provided to insurers. Anyone can go to hhs.gov and look at the top 15 languages that have been identified. And these are based on percentages of the population that speak that language. Some states like Alabama or Indiana that might not have as many ethnicities, these lists can become quite interesting because we start seeing some very rare languages that are spoken there that might be included in the top 15. And that might be because most people might speak English, Spanish, and maybe Somalian, and then the rest become very rare. But in California, we have lots of people that speak lots of different languages, and this is just an example, but there is a list for every state in the United States, and if you're curious about those lists, you can look up that website. But this should give you an idea, depending on what language you interpret in, the frequency that these language services are being requested based on the population. Please keep in mind that insurance companies and other people who participate in government-funded programs, and we'll talk about which ones those are, they have to provide telephone interpreting services in any language. That means if you don't see that language on this list, they still need to provide it if a member calls and says, I speak, off the top of my head, I'm trying to think of a language that's not listed here, but just think of any language you don't see listed here. If a member calls speaking another language that is not listed here, I'll say Navajo, that insurance company still has to provide interpreting services in that language. So this list indicates the top 15, but in no way limits the responsibility of insurance companies and other participants to provide language services in more languages than what's listed here. This list helps insurance companies know especially what documents, what languages they have to translate important documents into before they're even requested by a member. So Michelle's going to help me at this point. We're going to ask this question. So the first question that I want to ask all of you to get some feedback and get to know you is, have you ever interpreted for a healthcare company or a medical insurance related topic? Michelle's going to help me, and she's going to pull up the poll, and you're going to actually participate here.
So we have 81% saying that they have interpreted for a medical insurance topic, and about 20% that say that they have not.
80%. So I'm glad to hear that, and that actually really speaks to the fact that healthcare insurance is becoming a common topic. More and more people being insured want to have conversations or have to speak to people, providers in the healthcare system to find out questions about coverage, what's covered, what's not covered, let them know about changes of address. And now everything is on websites. So sometimes they need to talk to their insurer about their login in the member portal. So I'm glad to hear that so many people have already had some experience interpreting in this field. We're going to ask one more question to learn a little bit more about you and your experience. Do you feel intimidated by this topic? I know that when I've spoken to some interpreters, sometimes they fear getting or having to interpret questions about coverage because there's so many specialized terms that come up. So do you feel intimidated by the topic of medical insurance or its specialized terminology?
So we have 37% saying that they do feel intimidated, and 63% say that no, they do not.
Wonderful. I am very glad to hear that. So some people can get intimidated by some of the acronyms. I think in healthcare in general, whether you work mostly in clinic settings, interpreting for a doctor and a patient, there are so many acronyms and specialized terms that they can be a little intimidating, but I'm glad we have a very confident group here. So hopefully I just make you better by teaching you some more stuff here. So type of interpreters that are common in healthcare, one that is growing and is extremely large in the healthcare industry is phone interpretation, especially healthcare insurance companies. They depend on phone interpreting services to link their member services representatives to members. So usually customer service or anyone that works at the insurance company, they connect to whoever their vendor is to call an interpreter into the call. We do have in-person interpreters. There are lots of people who work for insurance companies or in healthcare that deal face-to-face with either the members and providers, because sometimes the healthcare insurance company is the one sending an interpreter to an office visit to help a member. Or sometimes there are agencies. Maybe the Department of Health needs to interview a member because of an issue in question. There's also a lot of bilingual employees. Like I mentioned, there's member services departments that have bilingual employees that sometimes function as interpreters. And of course, sometimes there's family members that are calling on behalf of the member to sort out some kind of issue or get information. The primary mode of interpreting that we use in healthcare, especially since phone interpreting can be quite prevalent, is consecutive. Using simultaneous might be extremely confusing. And we do have some sight translation that occurs especially because of all the letters that insurance companies often send to members. It might be a little confusing. They might not be sent in the language preferred by the member. So they call asking, what is this letter? Or what is this document? I don't understand it. So common settings, I say home because there are so many freelance interpreters working from home, and video remote interpreting is one of those modes or technologies being used to work from home. There are a lot of call centers. These are usually at the vendor, on the vendor side. They have call centers where interpreters are providing telephonic services. There's physician offices and hospitals where interpreters are being sent to. Often there's health fairs, really large health fairs that are created to help, especially underserved areas where insurance or coverage can be very limited. There's health fairs where they often require interpreters to come and help educate the population with nurses or whoever might be doing presentations. And then there's enrollment centers. For example, in California, I don't know if most of you are in California, there's enrollment centers for Covered California, and that's the Obamacare or the Affordable Care Act coverage. And sometimes they use interpreting services if the employees aren't bilingual. The common people in this type of session will be obviously the person who needs interpreting services, the interpreter, and then the third party. Specific to healthcare, that might be a nurse, a case manager, a member service representative, sometimes sales brokers, often pharmacists, whether it's at an actual pharmacy or at the health insurance company. Health insurance companies have pharmacy departments, which can be a little confusing if you are a telephone interpreter and you get a call and you hear that it's a pharmacist, but they're not actually at a CVS or a Rite Aid, for example. They're actually at the insurance company evaluating medications for a member, why something gets denied, or maybe they see duplicates in medications being prescribed. So sometimes those pharmacists are actually in the healthcare company. And then there's other entities that govern government-funded programs that often get involved in certain cases, especially if there's some kind of issue of access to healthcare. So Department of Health, CMS, or DHS might be involved, and we'll talk about those acronyms as well. There's a lot of topics that might be discussed, such as healthcare coverage, open enrollment, and this is a period where people who are 65 and older have the option to change their insurance company coverage, their Medicare coverage. So that's open enrollment, and that's a very specific time frame, usually towards the end of the year. Sometimes people call because there's been a termination of coverage. Maybe they don't fulfill the requirements to keep their medical coverage if it's government-funded program, or maybe they lost employment and their coverage was canceled. Often proof of eligibility, and these calls can get quite complicated because proof of eligibility might include talking about finances, talking about employment, immigration status. Proof of eligibility can become a very touchy subject and very complicated. Covered, non-covered benefits. These types of topics can also become complicated because you will suddenly hear lots of different terms for different types of care that might be covered or not covered. And then we have premium payments. We start talking about finances, cost share, deductibles, lots of terms, as you see here, that are very specific to insurers and how they pay for services or how the member is required to pay for the service or part of that service. Specialist referrals, when we talk about healthcare insurance, often the topic is managed care, and part of managing care means making sure there isn't overutilization of services or that someone is using the services provided in an appropriate way according to the healthcare insurance company. So often that means having referrals or a slip authorization of some type where the primary care physician or PCP might be required to refer the member or the patient to a specific specialist depending on their diagnosis or suspected diagnosis. There's hospital and emergency room admissions. Sometimes these require conversations about healthcare coverage or actual calls directly to the healthcare insurance company to let them know you've been admitted or possibly will be admitted. There's healthcare assessments or health assessments and care plans. These are usually done at the healthcare insurance company level and involve nurses that are case managers, and they follow up with members to determine what their status of health is. They ask lots of questions about your health history. So if you ever have to help with those types of calls, just be prepared to ask a lot of medical history questions similar to an admission at a hospital. Then there's website and portal, member portal questions. Those can be riddled with technology terms, and so you have to be prepared for that. And then there's grievance and complaints as well. Those can be difficult because usually if a member is talking to an insurance company about a grievance, they're upset. They're upset about something that happened, something they didn't receive, something wrong with their coverage, or maybe it was canceled and it shouldn't have been canceled. So be aware of those grievance and complaint types of requests that can be quite heated, and you have to keep your calm for those. I mentioned pharmacy can come up as one of the common topics in health insurance companies. Pharmacy questions can range from prior authorizations, and this is where I mentioned there's a lot of terms that might come up, and this slide is a little dense to provide a lot of those terms that might be mentioned. Pharmacists might talk to a member about a medication being on a formulary list, which is a list of the approved medications. They might talk about generic medications versus brand name medications. So you have to make sure you know how to interpret that and distinguish from the two, because it's two different classifications. They might talk about therapeutic classes. So you have to know how to interpret pain medications, chemotherapy, diabetic medications, you name it. Then there's over-the-counter medications and products. Over-the-counter usually means anything that you can buy without a prescription, but they are still listed in some of these drug formularies to tell a member that these are considered over-the-counter. You don't necessarily need a prescription, and we will pay for a certain amount of over-the-counter medications or supplies every month. This is true of Medicare and some other government-funded programs. They will give an allowance to members to allow them to buy over-the-counter medications a certain amount every month, where the insurance company will pay for $50 worth more or a percentage of that. That could be something like Aleve, aspirin, medications for your stomach, things that you can usually buy at any local pharmacy but without a prescription. There's also mail order pharmacy. This is very popular and encouraged heavily by healthcare insurance companies for members who have chronic diseases. If you have a chronic disease that requires you to take medication every day, every month, that you know you will need it for an extended period of time, insurance companies will often inform members about their mail order pharmacy benefit. And what it means is exactly what it sounds like. They basically mail the medications to the home of the member. The benefit to the member is that instead of paying, let's say they pay $20 every month for their medication, they will give the member a discount for using mail order, and they will send them 3 months worth of medication, but the member will only have to pay 2 months worth of copayment. So instead of paying $60 for a 90-day supply, they'll pay $40. This is a benefit to the member. The insurance company receives the benefit because usually they have great contracted rates with these pharmacies to provide those deliveries by mail. So as you can see, pharmacy calls or questions or sessions can become very interesting, very complicated. You might hear a lot of different terms in regards to types of medications that you haven't heard before. So just be prepared for that. So I'm going to show you a couple of different types of calls. And I'd like for you to think about what kind of glossaries you could create if you had to create glossaries. What kind of glossaries you could create just based on these types of calls. Maybe a call about pharmacy copayments. Someone's having problems with their login for the member portal. I have a question about deductibles and how to set up my payment plans. Assessments. A nurse has to call a member because they were recently in the hospital. Just think about all these things and what kind of glossaries you might have to create. And you might find that you have very specialized glossaries that you create based on these topics. You might want to have a glossary specific to internet terms, talking about download, upload, login, cancel, fields. There might be one specific to pharmacy, medications, all those things I just mentioned in the previous slide. There might be one specific to medical histories. If you interpret for someone often enough, you know what those questions are going to be. So you might create a glossary specific to the types of questions they ask. And then there's the forms. There's lots of forms that come up in this kind of field, such as power of attorney and advance directives. These can be riddled with some legal terminology. So you might create a glossary specific to legal terms that come up when discussing power of attorney and advance directives. Sometimes these will be interpreting sessions where you just have to discuss them. But sometimes you will also have to do a site translation depending on what the protocol is wherever you work. You might have to do a site translation and be familiar with some of the legal terms because there are legal terms often in these forms. Beware of acronyms. When in doubt, ask for clarification. If someone says HIPAA and you don't know what that means, ask for clarification. You'll be surprised how often the person that you're interpreting for doesn't actually even know the breakdown for that acronym. So you might have to just repeat the acronym to the member and then let the member ask, what does that mean? And the person that you're interpreting for might just explain what it means, but might not know exactly what CHIA stands for. But there's lots of ways to go back and research these terms. Most websites from health insurers, we're talking about United Healthcare, Anthem, Blue Cross, all those insurance companies, they usually have a member-facing websites, and those are usually filled with useful information for interpreters, such as acronyms, glossaries of common terms used to help educate members. And this might be very useful to you as an interpreter. As you can see, this is just a tiny sample of acronyms that can come up. Quantity limits specific to pharmacy, step therapy, out of network, that's specific to coverage when you go to a doctor that's not inside of your designated network of doctors you can see. Prior authorizations, this can be regarding medications, specialist visits. So there's tons of acronyms, and the best thing you can do, because you might not be able to know all these before a session, is to jot them down, just repeat the acronym as is, and go and research it. but often the member will ask, what does that mean, if they haven't heard the acronym before. So what kind of medical insurance options are there, especially here since we're in the US for Americans? And the insurance options available will depend on a couple of things like employment, your economic status, your age, any disabilities you might have, and whether you're pregnant or not. So there's a couple of government-funded programs. This is a high-level look at those programs. We have Medicaid. If you're in California, we call it Medi-Cal, and some states have different names for the Medicaid program because they are managed at the state level. There's Medicare, which is usually primarily for 65-year-old people and older. There's MEDI-MEDI, which is a combination of Medicaid and Medicare. And then there's Marketplace, also known as the Affordable Care Act or Obamacare. So Medicaid often is governed at the state level. It's also in conjunction with the Department of Health and the Centers for Medicare and Medicaid, also known as CMS. Again, very useful acronyms and terms to know. Who can be eligible for Medicaid? Often it's determined by whether you're a low-income individual. Federal poverty level is often discussed, so make sure you know how to interpret that. If you're pregnant or not, that can determine your eligibility. Again, going back to income and pregnancy, those usually in combination help determine if you're eligible. If you have a permanent disability, and usually that has to be certified by the Social Security Administration, that your disability, that is. Special programs, maybe you're in renal failure and you have to have dialysis 3 times a week. That might be a qualifying diagnosis. Babies born to mothers under Medi-Cal are also covered under Medi-Cal for a certain amount of time. So that might be what determines if they're covered. And people who are usually not covered under Medicaid programs are individuals 21 to 65. If they're not parents, not pregnant, not blind or disabled, usually they will not be covered. Medicaid covers a myriad of services from doctor visits to hospital care, maternity, laboratory, preventative, child services, you name it, usually at a zero copayment, since we are usually talking about people who are low income and qualify for the definition of federal poverty level or below that. There are some coverages that if someone is eligible for Medicaid, they also become eligible for other programs such as CHIP, which is the Children's Health Insurance Program. This is a partnership between the federal and state government, and these provide coverage to low-income children. About 1.3 million children are covered in California alone that are under the 19 years of age, and it provides comprehensive coverage, meaning that it provides a very robust amount of services that the insurance company managing the service will cover. There's also another service called CCS in California. For our sickest population of children in the state that have very specific diagnosis, usually very severe or chronic diseases, CCS will work with Medicaid to cover all the health care necessary for that patient, especially serious illnesses like epilepsy and cancer. The provider needs to request coverage, CCS coverage. Usually providers or doctors who are maybe in cancer specialties, they already know about this program and they request that coverage as soon as a diagnosis is confirmed. But it's good to know about this program in case you're helping someone who is unaware. CCS is a wonderful program. There's other criteria usually used, including financial, but again, if you qualify for Medicaid, you usually fulfill the requirements, the financial requirements to participate in CCS, and this is for children under 21 years of age. Medicare is a federal program, so we went from Medicaid, which is administered at the state level, to Medicare. Medicare is only managed at the federal program. You hear about Medicare often, especially during elections, for this reason. The entity that manages the Medicare program for the federal government is the Centers for Medicare and Medicaid Services. So you often hear CMS, the acronym, when talking about Medicare. Medicare is for 65-year or older folks. They usually, or people who have a special condition. So if you're not 65 years or older, you still might qualify for Medicare if you have a very specific condition or disability. That disability usually needs to be certified by either the Social Security Administration. I believe that's exactly who needs to do it. But there's other programs like the Railroad Retirement Board and TRICARE that could also qualify someone to receive Medicare benefits. So you might once in a while see someone who's not a senior citizen but does have Medicare and say, wow, I thought it was only for folks that are 65 years or older. They might have a severe disability that qualifies them to get coverage under Medicare. Medicare can become really confusing because of all the parts, and it becomes a puzzle trying to figure out what they're talking about. Medicare Part A, and as a side note, that open enrollment period I mentioned earlier, where folks can change their company, the company that's managing their Medicare, that's coming up soon. So you'll start seeing lots of commercials on TV from different healthcare companies about Medicare and changing your benefits to this company or that company. And they're going to talk about what kind of coverage they offer and manage. Medicare Part A is specific to hospital care. If someone has Medicare Part A, that does not mean that they can use that Medicare coverage to go see their doctor. It doesn't cover doctor visits. For that, they need to have Medicare Part B. And vice versa, someone can have Medicare Part B, but not Medicare Part A. So it becomes really challenging for folks to understand what exactly they have and what they're covered for. This will be a common topic during open enrollments. Interpreters are heavily used during open enrollment to help explain benefits. Brokers will brokers, which are basically salespeople, will present these benefit packages to senior citizens to help them make a decision on what to do. So Medicare Part A, hospital, Medicare Part B, specific to consults, physician offices. Then there's Medicare Advantage Plan, often referred to as Part C. So that is managed by a private health plan. So someone can get their, receive Medicare and then assign the coverage to a healthcare plan, and that healthcare plan is going to manage all their services and actually give them some extra benefits. And then you'll start seeing that in those commercials that you get additional benefits to your Medicare coverage. Then there's Medicare Prescription Drug Plan. This is Part D. This adds drug coverage to original Medicare. So original Medicare is the Medicare that the government provides. So the feds provide original Medicare. You as a recipient can decide to have a health insurance company manage it, or you can just keep it at original Medicare. That means that you're dealing directly with the government in regards to your coverage. No one's managing it for you. And if you want your drugs to be covered, you might need to purchase a Medicare Part D coverage to get your medications covered. So again, it gets really confusing. To manage costs, they break Medicare up into all these different parts, and it is confusing for people in healthcare, and it's confusing, absolutely confusing to senior citizens. I know my parents are now at the age where they're dealing with Medicare, and they have had a lot of questions about what these different parts mean. I mentioned original Medicare. This is managed by the government directly. That means no healthcare insurance company is involved. in managing your Medicare. There's also extra help, which is a different, an additional benefit of Medicare that someone must qualify for and request. It's based on income and resources. So for really underserved and senior citizens that may be very poor or have very limited resources, often they have fixed incomes, they might qualify for extra help to help with their drugs, to help pay for premiums, to help pay for deductibles, because Medicare often comes with a cost share, meaning that the recipient does have the responsibility to pay something. They don't get everything at a zero co-payment like Medicaid. So it does become a little challenging for senior citizens living in a fixed income to pay for some of their medical care. There's the State Health Insurance Assistance Program. This program can also help low-income individuals, but that's at the state level or managed at the state level. Then there's Medigap. Medigap provides assistance to pay for services of Part B, and that's usually purchased through a health insurance company. Again, we're talking about United, Anthem, Blue Cross, you name it. Medicare-Medicaid. People get confused with this type of government-funded program because of all the different names that exist for it. Medicare-Medicaid, often referred to as MMP, so the M is for Medicare, Medicaid, and then P is for plan. Also called MEDI-MEDI, also called dual eligible, and in California, also called CalMediConnect. So this is one single program that might be referred to with all these different names, and it's very, very useful to remember that so that you don't get confused, because it might seem in one conversation that they're talking about different coverages when really they're just using all these different names for the same program. I have interpreted and have translated materials referring to this kind of coverage, and they use all these different terms during one conversation. So it's very useful to remember that this is all referring to one program. And what it is exactly what it says. It's Medicare and Medicaid services combined. People who qualify to receive this kind of coverage are very sick usually, not necessarily senior citizens. They do get extra help. They get the prescription drug coverage added to their coverage without having to separately pay for that or request it. Their Medicare functions as their primary. You'll hear these terms, primary and secondary, often. That means who pays first. Okay, so when you hear primary, they're identifying what kind of coverage is paying first for your services. And then a secondary is the coverage that will pay for something second. So if it's not covered under the first one, then they might try to get payment from the second entity. Some people might have a third party that might actually be responsible to pay for certain benefits as well. So in MEDI-MEDI plans, Medicare functions as the primary, Medicaid will function as the secondary. And then the coverage will be managed most likely by a health plan, almost exclusively. These are patients that are very sick, so usually a healthcare company is involved to help coordinate a lot of the healthcare coverage or benefits that this person will need. It actually helps them because they can be extremely sick and need the assistance of a nurse to schedule appointments, get services, everything they need. Then we have Marketplace. Marketplace, also known as Obamacare, Affordable Care Act in California, often referred to as Covered California, and every state kind of refers to it slightly differently. It can get quite confusing if you go online and look at all the plans available, but really it's split up into bronze, silver, gold, and platinum. And you might be asked to interpret those terms, so just make sure you know how to interpret them. Ultimately, you should be able to just say the English term, because if they go on the website, they will still refer to them under these terms. It provides a minimum coverage usually. People younger than 30 years of age can apply for this, but really it's any age group. All the plans under Marketplace must provide essential health coverage, and that term will come up as well. What does essential health coverage mean? It means that the plans that are offered under Covered California, under Marketplace, provide at least these 10 categories of benefits. And sometimes in the case of pediatrics, it covers more than those 10 categories because they must include dental and vision as a supplement coverage. Let's take a look at those 10 essential coverage benefits. Prescription drugs, rehabilitation, lab, preventative services. This might be education for diabetes or renal disease, you name it. Emergency services, hospital care, maternity and newborn, mental health, pediatric services, like I mentioned, and ambulatory health services. So this might be outpatient care that the member needs. This usually is physical therapy, perhaps, or anything that requires the member to go receive services and walk out the same day. So we talked about government-funded programs. What's left is commercial. So everything else that we didn't discuss would usually fall under a commercial or private insurance. Usually this is the type of insurance that that your employer provides to you for working as part of their employee pool. They often have different product lines, and they are specific to each company because they tailor what kind of medical coverage they're going to provide. So I couldn't tell you exactly how one company versus another company, what kind of services their insurance coverage provides. Usually involves a health maintenance organization. This is the same thing as a health insurer. Basically, it's the company that will administer the services. And they usually have a service area for the health insurance coverage, meaning this is, they'll designate the coverage. Usually there's a certain mile circumference from a specific zip code. They'll designate where you can get coverage, what hospitals you can go to, what provider networks you can go to. But there are certain flexibilities in commercial insurance. There are PPOs. What this means is preferred provider organization. I know lots of people who know or have PPO insurance but don't know what it actually stands for. So that's a preferred provider organization. This means that you can go to any provider in the plan's network. So even though you can go anywhere, there is a pseudo network working in the background. And the point of doing that is that the healthcare company does usually pay a contracted rate for services when you go to someone in the network, but you can go to, let's say, a dermatologist without having to go to your primary care physician first. So that's the benefit of having a PPO. You don't have to work with referrals like you do with a managed plan. There's point of service plans. These are similar to a health management organization or an HMO or managed care, where you might need to get a referral from your primary care physician first before you go see a specialist. And then there's exclusive provider organizations. These have very small networks of doctors, specialists, and hospitals that are contracted to provide services. So usually the health plan has a designated network of people that they have contracted with to provide services for a very specific price point. And that helps them manage costs. In turn, you might not have to pay as much for your insurance coverage, or your employer doesn't have to pay as much for your insurance coverage. There's high deductible plans. These are becoming extremely, extremely popular and common. I know my husband has a high deductible plan, and you have the flexibility of a PPO plan, but as a recipient, you have a certain responsibility, financial responsibility of how much you have to pay up front when the year begins for your medical care before the insurance kicks in. So let's say a high deductible plan might require the recipient to pay up to $2,000 in medical costs before the insurance company will pay anything else that happens. That might go up to whatever amount. Maybe you received $10,000 worth of care that year because you were hospitalized. You might just be responsible for the first $2,000 before the health plan pays for everything else. And that's usually what high deductible plans are. They usually also allow you to have a health savings account. So that's an important term to remember. Health savings accounts are basically exactly what it sounds like. It's a little account that you are allowed to put money in during every payroll. And that money you can then use to pay for any of your healthcare coverage. The benefit of doing that is usually before you get taxes pulled out of your income. So it could be a tax benefit. There are some limits and very strict rules as to how you can use this account, but they usually are offered if you have a high deductible plan. And then there's catastrophic coverage. This coverage is very specific to just covering for emergencies. It's a very minimal coverage, and you can apply for certain, people often get it to just comply with the requirements that exist to have some kind of coverage, but they don't provide comprehensive services. So health maintenance organizations, federal and state programs delegate a lot of the services that we discuss to these health maintenance organizations or HMOs. But usually people will receive some kind of benefit if they assign those services to an HMO. They will receive additional benefits that they wouldn't get on its own if that insurance didn't get assigned to them. I mentioned earlier that if you ever get stuck on a topic or you want to learn more about a certain topic, or maybe you work with a specific health plan or carrier often, one way to really educate yourself and be prepared for any interpreting session is to go to their website. Most websites for health plans must actually provide any vital documents that may include member handbooks, summary of benefits, annual notice of coverage. And again, these are terms you should know how to interpret because these terms are often used when discussing with members where to find information that's vital to their coverage. But these documents are usually posted on carriers' websites, and you can go in there and they often will have at least the Spanish version posted as well that you can download and compare or just read so that you know how to translate or interpret certain words that that company uses or benefits or to create your own glossary for that matter. Lots of useful websites that will be a primary source. Just make sure that you're going to one of these insurers company websites. Usually the translations for documents that you'll find are done by language service providers. There is a responsibility of each health plan to make sure that every translation is certified, meaning that a translator has attested to the quality of the translation. Doesn't mean it'll be completely void of errors, but it should give confidence to the people reading it that someone who is trained has provided that translation. Healthcare.gov is an amazing website. It's geared towards people who maybe have never had healthcare coverage. So it breaks down what terms mean. There's awesome videos as well and glossaries. CMS is the main entity governing Medicare, Medicaid. There's lots of great tools. When you go to these websites, make sure to find the links that are directed to members because those will have the most simplified documents and information for you to extract glossaries from. There's a lot more information on these websites that are specific to legal terms that might be a little complicated and difficult to understand. And you can see the other websites that are listed there. And I think this concludes the presentation, and I want to thank you all for participating and being here this morning. I give you my contact information there. You can reach me through LinkedIn and send me a message if you have any additional questions for me. I know we're going to have a small period to answer questions right now, but if you need to contact me, please feel free to do so on LinkedIn. I'd love to hear from all of you. There are some handouts that you should see or be able to see right on this WebEx. There's a healthcare terminology list that I created for you with some of the terms that I discussed. Since there's people that speak many different languages, the English column is filled out, and I left the other column clear so that if you speak any other language than Spanish, so that you could have the opportunity to create your own glossary as well. And there's a list of acronyms. It's extremely robust. It's from a very useful website, so I hope that's helpful to you guys. And then the websites that I mentioned, I did put that on a PDF for you so that you can refer back to those after this presentation. Thank you.
Thank you, Gissel. That's a lot of information and, as always, very helpful. So we do have some questions that came in during your presentation, but I just want to remind everybody that you can do that now as well. If you have any thoughts or comments that you want to share or questions. I think it's also nice to hear if there's anybody that would like to share any experience that they've had interpreting for insurance or any dilemmas that they may have encountered. That this would be a good time to share a little bit about that, especially since Gissel did ask if people have had an opportunity to interpret for healthcare, and we had quite a number of people who did, for insurance, for healthcare insurance, and a number of people who did have that opportunity. So you can also feel free to share some experiences as well. So Gissel, going back to that language list that you mentioned with the there were the languages, the top 15, at least in California. And of course, as you mentioned, those are going to change depending on the state. But what about sign language? Where does that fall in? Obviously, it's not a spoken language, it's a signed language. But do you have a feel for the numbers? Do you know if that's on the list, or why that doesn't have to, why perhaps it's not included? It does seem like it would be in the top 15 as far as languages that are utilized, let's say, in California and elsewhere.
Yeah, that's a very good question. And I have to say, while working at my last job, when this new law came out and HHS published the top 15 languages for every state in the United States, I don't recall seeing sign language listed for any of the states. Now, I don't know what that means in terms of population, if the percentage just wasn't high enough to be in the top 15. I would be surprised in some of the states where they really had languages of lesser diffusion, like very rare, like Pennsylvania Dutch, for example. But I'd have to go back and look at that HHS website and see if they mention anything about sign language, because it did not come up, as far as I remember, in any of the documents. And the list is created using the state population and the percentage of people that indicated during this 2010, I believe, census, using the information that people self-reported as another language they speak. So I'm assuming sign language was an option during the census, but that I don't know for sure either. So I don't know if the problem originates with the census or with the percentage of people just not being high enough to be in the top 15.
And I think sometimes this has to do with written translation, that they want to make sure that materials are available in written translation. So that would exclude ASL in that sense. But certainly when we want to talk about the availability of interpreters, that would be something that we want to consider. So thank you to our participant for bringing up the sign language question. So as far as, you brought up the different modalities. Is it, do you have experience yourself working with over the phone or video? One of our attendees is wondering, and what might that be, if there are differences in doing that and working in those different modalities with regard to insurance?
So I do have experience. We actually, in this last company I was working for, one of the things we tried was actually creating our own in-house group of interpreters to handle or assist our our English-only speaking employees, to help them talk to our members. And because Spanish was our primary language used when requesting interpreting services, we created a call center to an interpreting call center just of Spanish interpreters. So yeah, I have lots of experience doing that, and some video remote interpreting. Usually these calls can be very short, and they are quick questions about coverage or something not being covered. They are often about pharmacy. We had a lot of calls about pharmacy. And I would say maybe 20% of those calls can be calls where the member is already aggravated about an issue. One of the topics I didn't mention that seem to be a common call is also transportation. A lot of healthcare companies provide transportation for members so that they can get to their appointments. There can often be issues where the transportation company or taxi company doesn't show up on time and doesn't pick up the member on time. So some of those calls were regarding irate customers complaining about a third party that the company was contracted with. But for the most part, these calls can be quite short. Unless you have a case manager, sometimes healthcare insurance companies will also have a nurse advice line, and that is staffed by nurses sometimes 24 hours a day. So if you work as an independent contractor for a language service provider and you work late hours, often that will be the type of call you have to deal with. It's a nurse trying to help someone determine if they should go to the hospital or an emergency room. Especially during flu season, it gets pretty crazy where lots of people are calling because their child is sick, especially babies, and they're not sure if they should wait till the next day to go to their pediatrician's office, or if they should take the child to an emergency room right away. So there really is a large variety of calls that can come up. And this is why I stress that as an interpreter, to be prepared, you really just need to be familiar with all the different types of calls that might come up and do your best and really create a glossary as you start taking calls from these types of healthcare insurance related topics.
Absolutely. And one situation that I can think of that we encounter frequently is enrollment meetings at businesses where they have to go in. You mentioned the enrollment periods, and having to go into companies and be in front of large groups of people to interpret the general information sessions, and then sometimes being together with the representative and the individuals when they go over their individual plans or individual situations. So those are two different types of encounters, I think, that are rather different from traditional medical encounters.
Yeah, absolutely.
So we have a comment here about about documents. So you mentioned some of the documents, not necessarily the ones that you provided here in the handouts, but some of the other documents that sometimes are reviewed. And someone pointed out that it's possible sometimes to get those ahead of time from the providers, and that they may perhaps be standardized forms. Can you talk about that a little bit?
Sure. Yeah, that's absolutely true. So if you are dealing with specific physician offices often enough, they might have standard forms they use to do the intake, to ask questions about coverage. Most of them, if you work with someone often enough, you can get a blank copy of those forms and take it with you and review it and create a glossary, or just write in any terms that you need to translate ahead of time to be comfortable. And usually, once you do it a couple of times, you'll find that you won't even need to refer to those forms. I know we had, I was managing interpreters that were used to doing health assessments with nurses, and after just a couple of weeks, they could anticipate the questions. Now they still needed to wait for the nurse to ask the question, but they knew what the script was like, and could anticipate those questions and already knew how to interpret them. They could probably even ask the assessment themselves if they weren't interpreting. So yes, you can definitely get lots of these forms ahead of time. If you know you're going to be working with a specific insurance company, often go to their website, download the member handbook or the summary of benefits, look at what it says on there. Usually, again, you can find translated versions of those documents on that member website for that insurance company.
It's interesting that you brought up the translations as well, because I know there's a lot of regulations as far as the translations of these different documents. I'm not sure if that's if you have any knowledge of whether that's a state specific or if that's more related to government regulation, but I know that there tends to be some real strict, I don't know if requirement would be the word, but guidelines perhaps as far as terminology needing to be similar or the same from one place to another. And sometimes you do see variations, but within companies, I know that sometimes when they change things year to year, or if they provide services in more than one state, they have to be very careful about the terminology that they're using. So I think what you're talking about as far as downloading that particular company's handbook is a really good idea, because there may be that they have to use specific terms, and if they've already had them translated, it's good to be aware of that.
Yes, that's absolutely true. Most companies work with contracted language service providers, and they might have a long-standing relationship with one or more providers that do specific types of documents for them. They might have someone that does strictly marketing, and marketing materials can be very different from what they call vital documents or critical documents. And these are documents that are usually mailed or sent to the member that explains what coverage they have, how to manage their coverage. And the terms can vary. Now, there are very strict regulations, and things like Medicare, the government, or CMS, I should say, CMS will, before open enrollment, they will start sending templates, English templates, to healthcare insurance companies with indicating how they want the companies to publish, let's say, their member handbook. And there's lots of blank spots throughout these documents where the healthcare insurance fills in their specific information about the coverage and how they deal with things. But there is a template that companies have to use. So you might see a lot of what we call common language throughout an English document from one insurance company to the other. But when it comes to the specific benefits and copayments, there might be variations, not only in the content, but also in the translation. So that might be because a company has an approved glossary that they like to use with their translation vendors, and they always use that. Or they might have multiple vendors, and sometimes one vendor linguist uses a term a little differently than another. So there can be some variation, but know that in these government-funded programs, especially Medicare, there is some common language, as it's called in the industry. There is some common language that is dictated by a template that is issued by CMS. So there should be some overlap and similarity from one company to the other in part of those documents.
Sounds good. And with regard to glossaries, we had a couple of comments about those. Now, you did provide this English glossary, and you also provided the resource websites. But we do have a question on whether or not you're aware of any glossaries that have already been translated.
Specific to healthcare, there are glossaries that are available. I mentioned the healthcare.gov website. If you go to that, there are some glossaries that are available. I'm not sure in how many languages, but I know I have seen translated glossaries on there. CMS.gov has some translated materials as well. So there are glossaries because all these websites do have member-facing pages. And with that, I mean that they have pages specific to members. And in the insurance industry, they're governed by what's called plain language standards. And that means that they need to write things in a way that's easy to understand for people who don't. Well, things have to be written usually at a 5th or 6th grade level. So they have to write things in a way that's easy to understand. So it's very beneficial to go, when you go to any website, if there is a member tab, click on the member tab and you'll find most of the translated resources on the member tab side. So I highly recommend that if you see tabs, and there's a tab for providers and one for employers and one for members, click on the members tab, and that's usually where you'll find a lot of these glossaries and translated documents.
Very good. And following up with that, one of our participants is saying that aside from just having the translation of the term available, that it's helpful to have the context and the explanations of those things, and perhaps have those explanations also translated in the language for that translated, because of the concept perhaps needing to be explained to the client.
Yeah, that's absolutely true. When you're reading any of these materials, part of plain language is explaining any terms that are specific to healthcare. So if someone does read, the most thorough document you could read is a member handbook. They're usually 200 pages plus, so they're very extensive, but they have a nice table of contents. So if you have a specific question about maybe coverage or termination of coverage, you can look at the table of contents and jump right into that section. But these member handbooks have to, and we're talking about heavily regulated industry, they have to explain any terms that are very specialized or particular to healthcare, so that any person with no knowledge of healthcare insurance can easily understand what terms mean. So absolutely, as an interpreter, it really helps to understand these things yourself, to not get lost in the conversation, because it is easy to get lost. And as we know, in any topic, you get tripped up with 2-3 terms, and then you just kind of lose your pace. So if you have time and the interest, definitely look at a member handbook and go to specific topics you might need to know to really understand how those conversations might read. One thing that I'll mention is that often the member services department of these healthcare insurance companies, they often have links to the member handbook. So when a member calls to ask a question, that representative often refers back to the member handbook. So if you read that, and if you have a translated version, you almost certainly will have most of the knowledge you need to have to be able to interpret that topic. Be very wary that there will be multiple handbooks based on, we call it the line of business. So one insurance company might provide coverage in California for Medicare, for Medicaid, and for MMP. So they will ask the member what coverage they have to determine which handbook or what materials to pull to answer questions. And those coverages for the same healthcare company might be very different state to state. So often they will ask the member what state they're calling from, what insurance they have, to pull up the correct materials. So keep that in mind.
Absolutely, and in reviewing those handbooks, it's in particular, I think with benefit information and dental benefits, I think as well, that there are so many terms that are very similar but slightly nuanced. So it's important to make sure that you have distinctions among all those different terms.
Right. You'll be surprised that sometimes even in dental, they'll start talking about specific dental procedures and which tooth or teeth that procedure can be done in. Sometimes it's a different price depending if it's a wisdom tooth versus baby teeth, so you'll be surprised the kind of terms that might come up where you're like, oh, I didn't expect to have to talk about the different types of teeth we have in our mouth, like in scissors, and so it really can vary.
Absolutely. Well, I want to thank you, Gissel, for all this information. It's all very comprehensive, and I'm glad that we've had a chance to talk about it, because I think it's one of those areas that we sometimes overlook, but it's very helpful to have this. And so thanks for all the information and for the resources that you provided for us today.
Thanks for having me. I really appreciated it, and it was my pleasure.